An outbreak somehow traced to visitors to Disneyland.
In 2014, there were...
In recent years, long since eradicated diseases have reemerged. However, the safety of vaccination has also been called into question.
2 years old, 2.5 years old, a child, a beautiful child, went to have the vaccine, now is autistic.
Today, the anti-vaccination movement is fighting against a new law called SB 277 that makes vaccinations mandatory for school children.
When you have children and you're told if you want them to go to school, they have to be vaccinated or they have to have a medical exemption. That's just not free.
If a parent isn't free to raise his or her child how they see fit, where is freedom? This whole thing is sick.
Parents call the shots. Parents call the shots. Parents call the shots.
In 1855, Massachusetts passed the first U.S. law mandating vaccination for school children. Today, all children in the United States are required to be vaccinated for certain diseases before school entry. However, 48 states allow exemptions for religious reasons, and 20 states allow exemptions for personal or philosophical beliefs. In Marin County, the rate of personal belief exemptions, or PBEs, are at nearly 3 times the state level at 7%, the highest level in the Bay Area. In June 2015, California Senate Bill 277 was passed and signed into law, removing the PBE for children attending public and private schools, effective the next school year. Opponents of SB 277 are in favor of other methods of disease control.
Can't we put better quarantine and isolation procedures in place? Because that's really what's going to stop viruses and stop diseases.
However, public health officials disagree.
There is no good way to prevent the spread of measles once it's out there. So quarantine and isolation is definitely not the solution, especially when we have something that's so much more effective and safe available to us through prevention.
Vaccine safety is one of the main talking points of the anti-vaccination movement.
If a parent took a child's oatmeal and put in things that are in vaccines, aluminum, mercury, formaldehyde, ethylene glycol, which is antifreeze, and fed that to the child, shouldn't that parent go to jail? So why should a doctor be able to put in a child's vein? This is insanity.
We know that vaccines for many years contained a mercury compound called thimerosal. Mercury is a known toxin. I had more and more patients coming in. Some of these children developed autism after a vaccine.
There is no, and I will repeat, no scientific evidence whatsoever that vaccines cause autism.
However, as vaccination rates have increased over the years, so have autism rates.
There was no such thing as autism. It didn't exist. And medical doctors will say, ooh, it's because we couldn't diagnose it. How stupid do they think we are? Like you're not going to notice an autistic child.
The prevalence of the awareness of autism in media and the relaxation of the criteria of what constitutes autism have been shown to increase the probability of someone being diagnosed with autism.
Many parents are worried about the number of vaccines their children receive.
The schedule for vaccinating young babies is way too severe. I think they should space them out.
By the age of 18 now, you're given 69 doses if you go with the CDC schedule.
Which begins, by the way, in the hospital at 12 hours old with the hepatitis B vaccine, which is spread, get this, by either promiscuous sex or illicit needle sharing. I don't know about you, but I've really never seen drug-crazed orgies in hospital nurseries.
Nonetheless, medical professionals advise the public to trust their advice.
A baby will pick up more challenges to his or her immune system just by crawling around on the floor than they ever will from vaccines.
Not vaccinating on the standard schedule puts your child at higher risk of getting that disease until they finally get caught up.
Severe allergic reactions to vaccines occur in 1 in 100,000 doses.
It was a flu vaccine that I got when I was working at Redwood, and my arm got as big as a football.
However, according to medical professionals, the benefits far outweigh the risks.
The side effects of vaccines are mild and far less than the side effects and the downsides of having these diseases.
Many parents are concerned about the potential effect that vaccines can be having on their kids. But for Carl Crott, it's a completely different story.
My son was diagnosed with leukemia about 5 years ago. We were in the hospital for 87 days in the first round. He was so sick at one point, he was too sick to get the chemotherapy. But if they didn't give him the chemotherapy, they wouldn't be able to cure the cancer. And there were a couple of nights where I literally had my head on the bed and said, please wake up. And they didn't think he was going to make it. That was part of a 3.5-year journey, over 1,000 doses of chemotherapy, 50 surgeries, so that he could be in full remission. And he's cancer-free today, and we're extremely happy about that. While he was doing chemotherapy, his immune system was wiped out. If he were to catch something else, he could get very sick, and then the same thing could happen again. He wouldn't be able to get his chemotherapy, and he could die.
And my immune system wasn't strong enough for vaccinations.
Here was a child who could not be vaccinated for medical reasons. They're adults living with HIV, living with all kinds of cancer. These people are at risk from vaccine-preventable diseases as well.
We wanted him to go to school, and we wanted to make sure that he was safe.
Herd immunity is the idea that a certain number of people in the community need to be protected in order for the disease not to be able to spread.
Herd immunity needs to be extremely high, in the high 90s, which is why a law helps us do that.
If my kid was school age, I would stand up and resist.
We're supposed to be the land of the free, and we truly on this issue are not.
For the benefit of the community, people need to give up a little bit of their civil liberty.
The role of government is to find the best way to make our communities safe.
Are you willing to obey a law that is in place that protects all of us?
I call on parents everywhere to resist this evil mandatory vaccine law.
Truly do your research and weigh up the options.
Please vaccinate your children.
If you don't violate the law, you allow your children to be violated.
Vaccines save lives.
Who should call the shots?